Advocating for yourself when you're living with MBC, stage 4 MBC, is incredibly important. And as you know, Metafiber funds MBC specific research, but it's up to you and your family and your friends to really share your stories with our national leaders to make sure they understand the really urgent needs of those living with MBC. When I was a Hill staffer, and I remember being on the receiving end of hearing people's stories, and those stories stay with you. They impact members of Congress. They bring the issue really close to home and make it so it's an incredibly effective way to be an advocate. So we're very thankful for you, for your willingness to share your story, to be on these webinars, to learn, and then to come into DC to advocate for the needs of the MBC community. Dane is going to speak next. Dane Christensen, he's with HMCW, and those are Metafiber's representatives in Washington, DC. And Dane and his team work every day in DC to make sure that we can help further our initiatives for the MBC community. But that work that he does, laying all that groundwork, is made so much more impactful by those of you who come in DC and do the Stampede. That really, it adds so much more momentum to all the groundwork that he's laid. So I'll turn it over to you, Dane.
Yeah, thanks so much, Alpha. And it's nice on the meeting today to see so many familiar faces as well as some new folks. I'll just mention at the outset, this is in a series of videos that we are doing this year. The first video was on Civics 101 and how our government works. The next three videos, including the discussion we'll have on appropriations today, are a little bit shorter. They're issue specific. So today we're going to be talking about how the government funds things like medical research and public health and the role that we play in that process. And then we're going to be talking about coverage and access on the next two webinars. And the webinar after that, which will be the kickoff for the Stampede and some of our other additional activities this year, will be a little bit more comprehensive. So we will have questions at the end. It's possible that if you have a question about how the government works, it might be in the preceding webinar. If you have a question about how the Stage 4 Stampede works, it might be answered at the event that we're going to do, the kickoff webinar in October. So we do have an hour set aside for this. Much of that is so that you can ask any questions and have anything you need to know answered. But at the outset, we have about 15 minutes today about specifically how our government works in the context of funding medical research and public health, and the role that we play as advocates in helping our elected officials understand that process. So we will jump right into it. And of course, as Alpha mentioned, my name is Dane Christensen. I'm at the Health and Medicine Council. My office is right by the Senate buildings in DC. But of course, as we talk about this, I want to be very clear. Members of Congress are not interested in me and me talking to them about federal funding or what the community needs. They're interested in you talking to them about what the community needs. These are your elected officials. They represent you. You might not always agree with them politically, but there's an underlying process that the country operates on, and that process is driven by constituents and work with their members. So that process is something that we are going to focus on as we talk about how we get into this. This is about policy. This is about procedures. This is not really about politics, if that's disappointing to anyone, but being effective with this and making your voice heard and having your seat at the table does drive things forward, like a medical research portfolio or like innovations and breakthroughs in science. We're going to talk about how all that works at the outset. So in the last presentation, we covered that we have three branches of government, and one of those branches is members of Congress, Capitol Hill, the House and Senate, your one representative and your two senators. And then in addition to having oversight of federal agencies like the National Institutes of Health or the Centers for Disease Control and Prevention, these members of Congress also have what's called the power of the purse. They decide on an annual basis how federal funds are spent. And this applies to all federal programs. And this is even something that is protected in the Constitution. What else is protected in the Constitution is your right to talk to your members as an advocate and tell them what you need and have an expectation that they're going to listen to you and respond. So on an annual basis, they have what are called must-pass bills. These are the spending bills. They are broken out into 12 smaller bills. There's a bill called Labor HHS Education that funds medical research and public health. and education and labor. There's a bill called the Defense Bill that funds, of course, the military. There's a bill called the VA bill that funds veterans programs. We don't need to be an expert on these things, though. We need to be an expert on our own condition and our own experiences and those things that we've experienced firsthand. Did it take a long time to get diagnosed? Were you surprised at the limited treatment options that were available? All these types of questions tie back into those gaps and justifications for why we need more resources for medical research and patient care. And your members of Congress are the ones to talk to about this. We don't talk to the agencies themselves necessarily. We don't talk to other stakeholders. We are talking to the senators and representatives who are deciding these funding issues on an annual basis. As I mentioned, this is done every year. They start making these decisions in January. And even though the federal fiscal year starts October 1st, they traditionally don't finish making these decisions until December 23rd of a given year. They finalize this stuff typically at the same time. We will be well positioned to make our voice heard if we're here for the Stampede and other issues. But unlike some bills that you might have heard of, languishing in Congress for years or taking a long time to pass, they must do the funding bills every year. They have to decide how much money is going to the federal government, the different programs, and what other instructions they're providing along with that, something they called committee recommendations. So in addition to deciding how much money is going to medical research, what is the House and Senate, what is Congress telling them that they think they should be researching based on what they're hearing from their constituents? So once again, the members are making these decisions, but it's a member-driven process. The members are driven by you. Your members of Congress want to hear from you as they're trying to make these decisions. When they have finite resources. They can't just write a blank check for everything. I think, as people know, they have to make tough decisions. How much money is going to the FBI? How much is going to the Department of Agriculture? How much is going to medical research? We're not here to arbitrate those questions. They have to answer that internally. We're here to tell them what our community needs and what we are asking for. So there's really two things that are in these appropriations bills or in federal spending on an annual basis. One is what's called discretionary spending. The other is what's called mandatory spending. And I'll only spend a moment commenting on this. Most of the federal government's budget is mandatory. This is not something that they're adjusting on an annual basis. Mandatory spending is things like Social Security. Congress isn't deciding how much money is in a Social Security check every month. Congress isn't deciding how much a Medicare benefit is. These are fixed costs. These are required by law year in and year out. The smaller part of the budget is discretionary. This is what they're deciding. When they write these spending bills, they have different line items. How much money for the Centers for Disease Control and Prevention? How much money for the Chronic Disease Center at the Centers for Disease Control and Prevention? How much money for the Breast Cancer Survivorship Program at the Chronic Disease Center at CDC on an annual basis? These numbers change. Last year's bill is always a guide, but they change these allocations every year, and they change it based on two things: the resources that they have available and the feedback they're getting from their constituents. You often hear about members from a military area being very invested in the military. It's probably because their constituents are members of the military and telling them that they need to prioritize those things. Similarly, we are a grassroots network. We are a constituency group. You're going to be telling your members what you think they need to work on and explaining why that matters so much to the community. And of course, if you think about what the government does, medical research turns into treatment development at the FDA, which turns into coverage and access issues at CMS. But it all starts with that investment in basic science that becomes those therapies that get developed. So the first start of this process, what brings us to better healthcare and more treatments, is simply that initial investment in science that the government is making. It's a common misconception that other stakeholders are doing this. Primarily, it is the government that is the US government that is the number one supporter of medical research and related activities. So really quickly, so how does Congress organize this as they are working on these different funding issues? And they have key committees. I want to be clear about this. The process is such that every single member of Congress gets to weigh in on these priorities. They all get to say what their funding priorities are for the year, what they would like to see supported, but there's a few key committees that keep this all organized. The first is the Budget Committee. The budget committee is the one that's saying, how much money overall do we have to spend? What is our budget? And how are we going to split that up amongst these different bills? How much for the VA bill? How much for the DoD bill? The top line allocations, the overall numbers. This is coming out of the budget committee early in the year. Some of you, if you follow the news closely, might know that we just struck a budget deal a few months ago. As the way bills move forward, this is something that the House had to agree to, that the Senate had to agree to, and that the White House had to agree to. That budget package was called the Fiscal Responsibility Act. That set the levels that not only for this year, but also next year, that appropriators are going to work on for the specific bill. So if you've done a congressional visit, or if you're going to be part of the Stampede, you're going to get a schedule with the offices that you're going to be visiting. If the members are on the budget committee or on the appropriations committee, it's going to say that. But the appropriators, the appropriations committees, then take those overall allocations and they turn them into those specific line items that go into each of the bills. So once you have the overall allocation for the Department of Health and Human Services, and you take out the mandatory funding that is going to things like Medicare and Medicaid, now you're deciding what goes into those individual line items for discretionary programs. How much is going to the Department of Education? How much is going to the CDC? How much is going to the National Institutes of Health? And how much is going to the Department of Labor? So your members are getting a lot of different input. It's very important that you put a marker down for the community on these issues. And also, of course, make a stand for research more broadly. It's one thing to talk about metastatic cancer or metastatic breast cancer research, which is where this is going to end up, but also just the importance of funding science and supporting research in general as they look at how to balance these priorities with other overarching agencies. So what is the funding situation right now? And also, what are some of these agencies that are so important to us? So if you look at this, let's start with last year, fiscal year 2023. We managed to see a number of increases that we were asking for. We asked Congress to provide more funding for the National Cancer Institute. They provided a $407 million increase. That's a lot of money. We asked for a funding increase for the National Institutes of Health overall. Congress provided a $2.5 billion with a B dollar increase. That's a lot of money. So out of that $2.5 billion, $407 million went to increase the National Cancer Institute's funding. There's also some other programs. The DoD, the Defense Department, it actively funds research now, and they fund what's called the peer-reviewed breast cancer research program at the Defense Department. They also fund the peer-reviewed cancer research program, which includes metastatic cancers. I think this is important to highlight just how advocacy plays a role in this. It's one thing to talk about those elevated numbers, more money for NIH, more money for the National Cancer Institute, but how does that have a more local impact? The reality is, over the past 7 years, the breast cancer portfolio has increased about $100 million. That is as a direct result of advocacy. That is also meaning that there is more money going to metastatic breast cancer research. I don't think anyone would say enough money is going, but more money is going as a result of the squeaky wheel getting the grease, so to speak. Community advocacy also means that the VA, the Veterans Administration, which has a research program too, is now doing metastatic cancer research because Congress asked them to. They were not doing this previously. Congress reached out and said, we think you need to be doing more work in metastatic cancers, and the VA is now. That matters. The other thing is that the DoD has had this peer-reviewed cancer research program, but it didn't include metastatic cancers up until a couple years ago. The reason the change occurred is, of course, because advocates said to their members of Congress, we're really proud of what the NIH is doing, but we should be part of DoD research too. Congress responded as they wrote these funding bills by adding metastatic cancer research in the law to make sure that the DoD is supporting that research too. So your outreach has a direct impact, not just on increasing the numbers overall, but ensuring that even new projects and programs get started. So before we move on, it might be a good time to say, well, geez, how do some of these mechanisms work? So when we say the National Institutes of Health or the National Cancer Institute, we are referring to the foremost biomedical research enterprise in the world. the NIH, and the NCI. However, the funding that goes there does not stay in DC. This is not a government lab that is doing this work. This money goes out to researchers all across the country, usually the leading centers in a specific area. So the MD Anderson Cancer Center, any other academic institution, be it Baylor, be it the University of San Diego, all of these scientists, some of whom you may know or who are your clinicians, are putting in what they call investigator-initiated grant applications. They're saying, we need to do science in this area. They will fund as many of the quality applications as they can, depending on how much money there is. So right now, about 1 in 8 of those grant applications gets funded, which means there's a lot of very good research that is not being funded. But the more money there is for research and the more money there is for the National Cancer Institute, that high tide raises all boats. The best way to make sure that your slice of the pie gets bigger is to make sure that the pie overall gets bigger. And of course, as there are more projects going on, that means science moves forward more quickly. That means treatments are developed more swiftly. That means we have more breakthroughs. The NIH largely lays the groundwork. They do the basic studies, they do the translational studies. This is often where industry comes in later because the US government does not develop treatments and then commercializes these therapies. But the work starts with NIH, and that funding is what ends up at academic health centers across the country for the research that ultimately moves things forward. Similarly, the Defense Department has a research program too. Of course, though, if you have metastatic cancer, the condition doesn't know if you're a soldier or not. So this work does not just apply to the military. It does not just apply to military personnel. However, though, this is not like the NIH. The NIH does research into every condition under the sun. They move forward where they feel like they can have the biggest scientific impact. The DoD has what's called the Congressionally Directed Medical Research Program. It moves forward where Congress provides them specific instructions on an annual basis. So when it comes to the peer-reviewed cancer program or the peer-reviewed breast cancer program, Congress is telling the DoD prescriptively, this is how much money and this is where we'd like you to invest and do more work. And once again, your members of Congress, your senators and representatives, as they write those bills, are making those decisions based off of input from you. Saying that you need to keep metastatic cancer in the DoD program matters a lot, but also having nobody tell their senator this is important and needs to be maintained has an impact too. They really do respond locally. If no one reaches out, if no one says this is important, they aren't going to prioritize it. They are going to move on to something else. So we have done a very good job of moving things forward, but we also do a good job of making sure that they don't slide back and that we lose ground that we've made in previous years. Another thing that happens is that Congress, when they write these spending bills and decide how much money is going, they also provide what they call committee instructions. They don't earmark funding for specific activities, but they say where they believe that a big impact can be made. They do include a lot of instructions now on metastatic breast cancer. One thing that has been a recent advancement as a result of the community also is progress in something called the Surveillance Epidemiology and End Results Registry. Now, this is a little bit wonky, but some of you might be familiar. The SEER registry was established in 1970s. It was actually signed into law when Richard Nixon was president. This is the country's data tracking system for cancer. This tracks outcomes, this tracks prevalence, this tracks related things. Since this system was developed in the 1970s, though, it does not track metastatic disease very well. The science has moved forward, the regulation has not. So since the community had been telling Congress about this, they've been calling on their elected officials to invest in modernizing SEER and making sure it better captures metastatic disease. Congress has done this the past couple of years now. They have told the National Cancer Institute and the CDC, which work together to manage this program, you have to make sure metastatic disease and the progression of metastatic disease is better represented in the SEER registry. The data is incomplete. The data needs to reflect what we now know, and we need to have a standardized way to report that. The agencies, of course, are working on this now, and this is just an example of the language that's included. When they say CJ, they mean congressional justification. So the agencies have to provide a report when asked saying, this is what we've done when you asked us to do it. NCI and CDC are going to be providing those updates. They were told you must modernize SEER and capture metastatic disease. Now they're going to be providing the report saying, this is how we're doing it, and these are the resources we might need moving forward. So if they tell Congress to do this properly, we need another $10 million, then it's incumbent upon us to tell our elected officials that and make sure that money materializes in the spending bills to allow this process to move forward. But advocates who are asking for this were not telling their members of Congress as experts on civics and government, you need to manipulate these mechanisms, or we need to do this, that, or the other thing with SEER. They were simply saying the SEER program right now doesn't work for us. It's not capturing metastatic disease. And it's those elected officials and the agencies who respond to you and figure out what the solution should be and how they should respond. In this case, it's modernizing SEER and providing the money that's needed to ensure that modernization can happen. So also, what are some of our goals right now? I think as folks know from Schoolhouse Rock or anywhere else, a bill needs to pass the House, needs to pass the Senate, needs to be signed by the president to become law. The reason that the funding bills are must pass is because if they don't do this, the government shuts down. It stops operating. It runs out of money. Now, this was something that, was just kind of a thing years ago, but in recent years has become more common. We've seen these brief shutdowns as they've debated what to do next. And we even are, if you watch the news, are probably hearing about the potential for a shutdown right now. If on October 1st, they haven't made progress on these bills, the government will shut down. We're glad that we're not going to be on Capitol Hill that day because government is technically closed, even though they're still working on this until they can pass this and move forward. But they don't pass the actual spending bills on October 1st. They pass what's called a continuing appropriations resolution that buys them time until December to actually finish the bill. So when we're on Capitol Hill later in October, we're going to be providing input to them as they make those final decisions for December. But the reason it is must pass is that they have to ultimately enact something or the government grinds to a halt. Sometimes it grinds to a halt briefly, but ultimately they have to move forward. They have to decide how much money for NIH, they have to decide how much money for CDC, and they have to decide what other instructions they're including on things like the SEER registry. So the House has put out a proposal now. They have not passed, the House has not passed its version of the labor HHS education bill. So the House does not have initial numbers on what they're saying should be funded. They have passed a DoD bill, though. Historically, of course, the military is one of the most broadly supported things in America. So the DoD bill and the Veterans bill move forward pretty easily and tend to have a lot of increases. Other bills are more complicated. The labor HHS bill is more complicated, but not because of NIH or CDC, because of all the other parts of healthcare that members of Congress might have strong opinions on. So the House has not yet put out its proposal for NIH, CDC, and this type of funding. The Senate has, though. The Senate has marked up its bill consistent with those tight budget allocations they have this year. They are proposing some modest increases. They're proposing $547 million for the CDC. They're proposing an investment in the National Cancer Institute, and they're proposing some modest increases for NIH. We're here to tell them when they come back and try to figure out how much to fund at the end of the year, we need you to give as much as possible. Please give as close as you can to $2.5 billion for NIH again. Please come as close as you can to a large increase for CDC again. They will decide what they can do. We can tell them what can reasonably be spent. And I think anybody on this call would know, nobody would say that the metastatic breast cancer portfolio or the metastatic cancer portfolio has enough right now. It needs more. It probably needs more than Congress can give, but we can tell them that there are gaps that need to be filled and there's more work that needs to be done. And they're going to work out negotiating these final bills. So you still have a very active role to play in the process. They're still also deciding what the DoD programs are going to look like. But rather than even get into the specific numbers, it's important that they just know we need increases. We need increases because there's more work that needs to be done. Us bringing them that story and telling them that we need help is what's going to continue to see these increases in the appropriations bills year over year. to continue to facilitate that scientific progress in medical research. So even though you're not a scientist or a clinician, your clinician, any scientist you know, should probably give you a thank you, because it's your advocacy and outreach with your legislators that make sure those additional resources from science are ultimately available, and that we can fund both ongoing and emerging research projects and public health projects for the community. So I hope that was helpful. I do want to close. This is a summary of the upcoming meetings before we stop the recording and open it up for questions. But of course, your voice matters in this process. Sharing your story matters. You don't have to be an expert on civics or government to be effective. The mere fact that you took the time to visit their office, talk to them, and say, we need more money for research and public health, allows them to have that need to respond and to prioritize these things moving forward. So we really do work together to be effective. And I thank everybody for learning a little bit more about appropriations and federal funding today. So thank you very much. And of course, we're happy to respond if anyone needs anything. Sonia, I'm going to hand it back to you.